Hi there, I'm Dr. Shawna Darou, and thank you so much for being here today. I'm a naturopathic doctor with a focus on women's health and hormones with a clinical practice in downtown Toronto, and I also work with some of my clients and patients online as well. I wanted to give you a little bit of an overview of some of my health philosophy so that we can learn how to work better together. So number one, first thing I wanted to say is that self-care is not a luxury. We live at a time where we are constantly in a hustle and a rush, and we rarely carve out the time for the basic self-care, meaning your nutrition and moving your body on a regular basis and getting enough sleep, having downtime, managing stress. And all of these things are absolutely crucial and the baseline to optimal health. And as a naturopath, we can't correct a bigger health issue without first addressing these. And they're huge. So what studies and research show is that these self-care basics prevent and treat nearly 80% of chronic illness. So that includes the heart disease, the diabetes, the cancer, and more. So if we're looking at how do we promote optimal health and well-being for the long run, we absolutely can't neglect the self-care. So third is that I work with hormones every day, and that's definitely a huge area of focus in my practice. And our hormonal systems all communicate. So for example, we can't address fertility or bad PMS or perimenopause symptoms if we don't look at the hormones as a whole. So we're looking at your reproductive hormones like your estrogen, your progesterone, your testosterone, your androgens. We're also looking at your thyroid hormones, and we're looking at your adrenal hormones like cortisol, DHEA, adrenaline. And they interact also with your blood sugar regulations, your insulin and your glucose levels. So we need to look at the hormonal system as an integrated whole that communicates together, because otherwise we're going to get lost on trying to bring up or down one hormone without looking at the big picture. Fourth, and this is a biggie, is that our bodies heal in a state of rest. I'm going to say that one again because it goes so contrary to our culture of doing more to get better. So our nervous systems are divided into two parts, the sympathetic and the parasympathetic nervous system. And the parasympathetic nervous system, which is the rest and digest part, is where we heal and repair. So if we are going constantly without downtime, without managing our stress, our bodies can't heal from chronic illness. And this is a huge one that I talk about every day, and I would love to support you with as well. So fifth is that hormone balance is affected by so many other factors as well. Your gut, your nutrition, your stress levels, your mindset, your beliefs, how you exercise, your weight, your sleep habits. So again, as we're looking at your hormones, we need to address your health as a totality, not just look at what is your estrogen doing. Now that's one big piece of the puzzle, but if we're actually going to support hormone balance without the use of medications, then we need to get to all of the factors that affect your hormones. Sixth, stress, from my vantage point, is the biggest factor that is affecting our health these days. Now, stress is also, eating irregularly. It's not getting enough sleep. It might be over-exercising. It might be pain or inflammation. So all of these things cause a stress hormone response in our systems. And if we're going to be looking at how do we support your overall health, we definitely need to address stress levels. 7, when in doubt, start with the gut. Now that's something I learned years and years ago. Our gut impacts absolutely everything. It's been called the second brain. It affects your weight, it affects your hormone balance, it affects your mood, it affects your energy, it affects your immune system. So it's something that for most of us as adults is out of balance, and it can make an enormous impact in your overall well-being. The last one is that self-care, self-love, and self-worth are absolutely crucial and critical to your health and well-being. I feel like we're at a crisis where women are putting our needs last, meaning we're taking care of people at work, we're taking care of our families, we're taking care of our parents, we're taking care of our friends. And unless we put our own needs up higher on the totem pole, we're not going to get better. So that's something that I also speak a lot with my patients and clients, is how do we actually start to prioritize? And I really believe that that comes from a place of self-love and self-worth. Thank you so much for joining me today, and I look forward to working with you. You can check out the website for lots of ways of learning more. There's a very active blog where I post weekly. You're welcome to contact me in the clinic. I'm still taking new clients either in person or online. And I also have some online programs that you can engage with as well. Again, have a wonderful day, and thank you so much for being here.